Good afternoon, and thank you for joining me as we update you on COVID-19 pandemic here in Erie County today. I apologize that Mark can't be with us today. He had another obligation, a work obligation, but he will be back with us next week. Today we have 62 new cases to report and 1 additional death here in Erie County. That brings us to a total of 16,712 cumulative positive cases since the pandemic began, and a total of 427 deaths reported in the NED systems of Erie County residents. As of this morning, there were 34 total individuals with COVID-19 hospitalizations, 3 of those individuals being on ventilators here in our Erie County hospitals. The positivity rate for Erie County was 8.4% for the week of February 5th through 11th, according to the Pennsylvania Department of Health. On the one hand, we have seen a relatively steady decrease in our positive case numbers over the past few weeks, which of course creates some optimism for us. But on the other hand, we have lost 427 lives here in Erie County since the beginning. I don't know about you, but I don't want to lose one more of our precious fellow residents. We continue to be optimistic about the vaccine, but I'll remind you that it still could be months until you get the ability to be vaccinated. So I encourage you to check the vaccine information at eriecountypa.gov. This information gets updated regularly. But remember that the vaccine is not our only tool. Continue to wear a mask that covers both your nose and your mouth when you get near anyone who does not live in your home with you. The CDC recently made some additional recommendations around double masking. Add layers of material. Use a cloth mask that has at least 3 layers. So it could potentially, I've got some props today, could it potentially be a 2-layer mask like this one with a pocket where you could put a layer of, for example, a filter in there. So that would be a good one to wear. Wearing one disposable mask underneath a cloth mask is also another option. The second mask should push the edges of the inner mask across your face. Check that it fits snugly around your nose and your mouth and your chin. So taking that disposable mask, which this one has one of those nice pieces of metal in there to hold it down on your nose, and then when you take a second mask, this is a 2-layer cloth mask over it, also with a nose piece in it. Now I have a much tighter fit across my cheeks, across my nose, and across my chin, making it much safer for me when I go out into public, the grocery store, anywhere where I might be around any groups of people. Make sure that you can see well, and of course that you can breathe easily. And we are seeing results with this masking that actually equal the results we're seeing from someone who gets vaccinated. So until you get vaccinated, I suggest that you find yourself a very good mask to wear, double the mask, and wear your mask as much as possible. Now, if you are fortunate to have a KN95 or an N95 mask, one of these, then you would just wear this singly. Again, make sure that you pinch down around your nose with a piece of metal, and you have a nice solid fit all the way around the mask. Continue, of course, to keep your 6-foot distance from others. Stay home, of course, as much as possible, away from crowds. Wash your hands frequently, and definitely, if you feel ill in any way, stay home, and we recommend that you go get tested, and you can find the testing sites at eriecountypa.gov. I'd like to also share that the Active Elders at Home But Not Forgotten TV show is airing again this Sunday, February 21st at 3 p.m. on WQLN PBS, channel 54.1. This 1-hour TV show is for seniors who are either living in long-term care facilities, rehab facilities, assisted living apartments, senior housing apartments, or simply alone who are struggling because their activity is limited, especially maybe during this winter weather, and visits with family and friends are often restricted too. We haven't forgotten how hard this is for you, and you are not alone. Hosted by Tracy Tudope, who we know is always a breath of fresh air and brings a lot of energy into a room. She works with local experts to help you learn how to safely increase your physical activity where you live. Understand how to work through feelings of fear and anxiety, sadness that's been brought on to so many by this pandemic. And discover how to use your mental wellness tips to actively break out of social isolation. So please tune in this Sunday, 3 o'clock, WQLN. And now I'd like to open up for questions from the media. I do have with me today Melissa Lyon, the Director of the Erie County Department of Health, to help answer any specific questions, so you can address them to either myself or Melissa or both. And today we're going to start with Erie News Now.
Good afternoon. A question for Director Lyon. Director, we saw last week the state roll out sort of some new guidelines, some new plans to try to vaccinate people more quickly. My question is, are local hospitals in compliance with that? Because at the moment, they're not vaccinating anyone in Phase 1A. They're restricting it to people even older than 65, people within their databases. They're not fully open. Not anyone can schedule an appointment there. So will they have to make changes because of this new state guidance?
Yeah, thanks for the question. And the information that came out last week from the Pennsylvania Department of Health really was an order, and that order had multiple compliance pieces to that. Staying within 1A, that does not necessarily mean that you're just open to anyone that fits into 1A to have that. I do believe the health systems have been staying within the 1A compliance. However, they would be better positioned to answer that specifically for you, since I do not have access to the demographics for each vaccination that they administer. I only have access to the vaccinations that are administered through our ordering process for the Erie County Department of Health, which are the ones that we are responsible for. I think the order that was put forward last week out of the governor's office with the Secretary of Health actually was put in place to really get high volume throughput vaccine into the communities, and our health systems are best positioned for that to happen. I hope that's answered your question. Thank you.
Thanks.
Thank you, Ethan. Jet TV.
Yep, good afternoon. It's Star Bodie here. So the Pennsylvania Department of Health announcing today that they misallocated over 100,000 doses of vaccinations. Wanted to reach out to you guys to see if any of that is affecting here in Erie County, our healthcare providers, and to get your insight to hear that more than 1,000 were, there was an allocation mess up.
Sure, it sounds like it was inadvertent, and I'm going to have Director Lyon address this further, as she's been on a couple phone calls about this in the last 24 hours. Director Lyon?
Thank you for giving me the opportunity to provide a little more clarification on what the State Department of Health is experiencing around vaccine first dose and second dose, in particular to Moderna. So they have assured us that this is not impacting Pfizer doses, first or second dose, but it's actually a reallocation for second dose Moderna. It sounds as if there had been an inadvertent administration of second dose as first doses. So facilities had received second doses and inadvertently administered those as first dose. There's nothing to worry about as far as the product, because ideally they are the same vaccine. It's just you need 2 doses of that vaccine. What's happened is now they are in the cycle of needing to fulfill second dose orders. And the orders that came in were close to 200,000, or maybe even a little over 200,000. And the allotment that came from the federal government is not able to fulfill the 200 second dose requirement. So you can see the demand for second doses is going to be difficult to fulfill. That's what they were describing today. My understanding is they have looked at excess inventory, and I think they were alluding to inventory throughout the Commonwealth, and in particular to the federal pharmacy program. So if they have vaccines that they could then pull from to fulfill those orders, they were going to do that, as well as the emergency use authorization indicates that the Moderna vaccine can actually, second dose can be given up to 42 days. And so asking to reschedule some of those second dose appointments closer to a 42-day so that then there's more time to fulfill those second doses. It's very unfortunate that this has happened. I think from Friday or last week's order, getting data in quickly is very important. Getting vaccine out appropriately is important. Making sure they're clearly understanding what's first dose and what's second dose. So an inventory management issue has definitely occurred, and I think some responsibility it lays on the State Department of Health's infrastructure, but I think there's also responsibility that lays with the providers throughout the state as well on how they manage their inventory. So there's not to be a blame game here. It's just the magnitude of the expectation and the amount of vaccine, and then having it be a second dose and multiple products. It's a lot to manage from a public health perspective and from a public health infrastructure that's been underfunded for decades. We were bound to run into issues that you're seeing here. So I hope my thorough response helps clarify some of that. And I'm willing and happy to take additional questions and answer as I know details. Thank you.
Sure, yes, just following up on that, did that have any impact here in Erie County, those misallocations?
Yeah, that's a really great question, and I don't have an answer if that will impact us here locally. It will depend. Basically, what's happening is if first dose orders were placed, we will then see what orders will be fulfilled. So I anticipate that some providers in Erie County will not have their full order fulfilled, and they may not have any of their order fulfilled, but I don't know what that looks like right now. So I couldn't be able to estimate the number of doses or anything like that. Each provider will have the specifics around that. Thanks.
Thank you, Star. We'll go to Erie Times News. We have David with us.
Yes, Kathy, thank you. A question I've asked before, we're trying to get statistics for what are the percentage for vaccinations at our local nursing homes, what percentage of staff or number of staff, what percentage for residents or numbers. It's very difficult to get this information. Does the county have any of that? Is there any idea, what percentage of the staff and residents at our local nursing homes have been vaccinated against COVID?
I don't believe we have all of those statistics, but I'm going to turn it over again to Director Lyon.
Thanks, David. No, we are not the repository for that information. Long-term care facilities and congregate care settings report directly to the state as they are their licensing entity and agency. We are not a pass-through for that. We really are just a support entity for them, and in particular, when we talked a lot about long-term care facilities in the beginning of the pandemic, we are fulfilling a support role for disease investigation and outbreak management and control. So that type of data does not necessarily land at the health department, and if we get any of it, it would never be comprehensive because there's not a reporting requirement. Thank you, David.
Sure, and let me follow up with the county executive on that. Kathy, not having this information, it kind of seems like this is a really vital piece to know, out of our most vulnerable folks, how many of them have been vaccinated, how many of the staff have been vaccinated. How important do you feel it is to have this kind of piece of information?
Well, I think it's actually very important, especially as we're trying to get that herd immunity, and we know we need to get somewhere around 80 to 85% of people vaccinated in order to achieve that. But even in our own few departments of the county government where there has been vaccine allocated and given because of HIPAA laws, I don't know who those people are. I'm not even exactly sure of the specific number. So these are some of the constraints that we all are running into, and I am troubled when I hear from some facilities, and to your point, long-term care facilities, some of their management that I've talked to are only seeing maybe 55, 60% of their people who are getting vaccinated, and even some of their residents who either the resident or their family decides they do not want them to be vaccinated. A case in point, as I talked to, of course, the management out at Pleasant Ridge Manor because of their connection to the county, and there is concern. So again, David, you're right. It's a big concern, but we do not have access to that data. Thank you.
Thank you.
Talk Erie. Do we have Joel with us?
Yes, thank you, County Executive. I appreciate it. Another metrics question for the Health Director. Melissa, is there any ability by the Health Department to know how many individuals are estimated in Phase 1A of the rollout and how we're doing in Erie County in vaccinating those people?
Yeah, thanks, Joel. I don't know that that's a metric that we have put in front of us at this point. I know there have been some estimates tossed around earlier, but I'll be honest, I don't recall what they were. I can talk to you from the perspective of the number of individuals that could fall into that chronic disease or underlying health condition. It's going to be a significant number. It's going to be quite large of our overall population. And how well we're doing there, again, it would require the Erie County Department of Health to have access to demographics for every single vaccine that was administered in Erie County, and we don't have access to that. We only have access to the vaccinations that we, as the Erie County Department of Health, order and administer. So it's a really layered system, and I don't have access to that. I will have to pull directly from the State Department of Health. So I'm sorry that I don't have better information for you.
So there's really no way of even giving us a time range of when we could expect the county to enter Phase 1B, which is those frontline workers and education workers.
You're correct. To make that estimate would be very difficult right now.
Thank you.
Thank you, Joel. We'll go back to Erie News Now. Ethan.
Hi, another question for Director Lyon. Director, are we any closer to seeing mass vaccination sites set up through the county? Any closer toward finalizing plans on that?
Yeah, so thank you for the question, Ethan. I think as far as the logistics that would be needed to be holding larger vaccination clinics in Erie County are really in place and for the most part finalized, and I can give you some examples of what would be finalized. So having a secured a pool or pipeline of volunteers to either vaccinate or assist with some of the general requirements at a large mass vaccination clinic are in place. I think scheduling components are ready to roll out. The dates and times and flow of how we would hold those mass vaccination clinics are also pretty well established. The limiting factor right now is vaccine. And if my healthcare partners were here with me on this press conference today, I'm confident you would hear something very similar from them as well, that they're really ready to go. Their logistics are sorted out, and vaccine in significant quantity still ends up being the limiting factor. So until we have that, it becomes very difficult to schedule. If we're going to schedule 2,000 to 3,000 people per day, we would have to be guaranteed that that vaccine is available. And as you heard today from the State Health Department, they need to figure out how to correct this problem of second doses, which is going to impact availability of first doses. And it's not just going to be for this week. This is going to happen for a couple of weeks. And so I'd say that across the Commonwealth, there's probably some hesitancy to have large mass vaccination clinics available. So thanks, Ethan.
Director, how much, provided that it gets FDA approval, how much would the Johnson & Johnson vaccine help those efforts where it's one shot and where it also puts another vaccine on the market? So supply goes up and logistics become a lot easier. How much does that help?
Yeah, I think having another product available for vaccination would definitely improve our efforts. I believe that the manufacturing requirements put forward are, they're ready. I think Johnson & Johnson is just needing to get the emergency use authorization. and that will ease the requirements. We would definitely be using J&J first dose or single dose option for populations that we think would be difficult to get back in for a second dose. So those would be more transient populations, such as homeless populations, individuals that have housing insecurity, that are just a little more difficult to schedule for 2 doses. So we would prioritize some of the populations that could benefit from that. Thank you for asking that question.
Thanks.
We'll go back to Jet TV. Star.
Yes, thank you. I'm seeing on the Pennsylvania Department of Health website that on February 11th, it was allocated to the Erie County Department of Health 1,000 doses of the Moderna vaccine. Just curious as to where those went and if you had any more since February 11th come in.
Director Lyon, you want to answer that?
Sure. So our doses on February 11th that had arrived, we are in partnership with LECOM's Institute for Healthy Aging. They are holding clinics, as many of you are aware, at the Bayfront Convention Center, and I think they've held up to the last one they had on Monday, were a couple 500 or somewhere around there. So the vaccine that we're securing is being used for those clinics. We are helping to prioritize what populations they vaccinate. Some of the other efforts is going to housing authority, people that have a difficult time getting to locations. So Erie County Department of Health's priority populations are those that typically experience barriers to access to care. The healthcare systems really do a great job getting those individuals that are already sort of plugged into the healthcare system. We are always looking towards the populations that have some additional barriers. So we work closely with LECOM. It is a partnership. It is a contract that we work together to do this. So that's where the 1,000 doses have been administered. Thanks for asking. Oh, as far as a second order, we put orders in every week, and I would have to go back to my team to figure out when we received our last doses of a vaccine. But thank you.
Thank you, Star. And I want to also just reiterate, we're talking about the Housing Authority, but we're talking about people who are 1A within the Housing Authority facilities. So the senior living facilities, for example, are the ones who are being targeted, so they would be in that 1A category. I don't want anyone to think that we're going outside of that within the Housing Authority. We'll go now to Erie Times News, to David.
Thank you, Kathy. A quick question for Melissa. Melissa, have we had any reports in Erie County of the variant strains at this point?
Question, no, we have not had any that were reported in Erie County. On my call today with the State Health Department, there have been 26 reports of the UK variant here in the Commonwealth, but none have been identified to Erie County that I'm aware of.
Okay, and a quick follow-up. Also, there's been a lot of talk in the national press in the last day or so, returning to the multi-system inflammatory syndrome that's found in some children, I think about 2,000 nationwide. I know there's been 94 reported in Pennsylvania. Have we seen any cases of MIS-C among children in Erie County?
David, I'm not sure that we have, and I would have to go back to my team to ask if anything had been reported that they know of. So I'm unable to answer that one thoroughly today. Sorry.
Oh, that's okay. Thank you.
All right, Joel, talk Erie.
Yes, hi. This is for either you, County Executive, or Director Lyon. You know, school districts in Erie County have had all of their K-8 elementary students back to at least a hybrid approach to learning. Now, that's despite the new CDC guidelines that call for all remote learning in areas that have significant community spread, like Erie County. So can you all explain the discrepancy between the CDC, the Pennsylvania Department of Education, and what's happening on the ground here in Erie?
Well, one thing I will say first, and then I'll ask Director Lyon to maybe fill in here, but it's important to remember in this Commonwealth, we have many different governing entities, and they are all independent of each other. So, for example, county government does not supersede a township government or a city government. None of us supersede a school district government entity. We're all our own independent government entities. I think that's the way our founder, William Penn, wanted it, and sometimes it's great, and sometimes it makes it more difficult. But we cannot tell the school districts what to do, and we can only continue to be a support and guidance to them and of which we've done a lot of. And I will ask Director Lyon if she has anything further to that she wants to add.
Thank you, County Executive, and thank you for asking the question, Joel. I do know it's been some time since I visited this topic, so I will be as thorough as I can. I know earlier in the fall, there had been conversations between the Department of Health, Pennsylvania Department of Health, and the Pennsylvania Department of Education, and they came up with a joint task force that was working on the guidance for school districts. And one of the points that came out of that were if school districts were going to go against the CDC guidelines or the Pennsylvania Department of Guidelines based on widespread virus in the community, they had to just submit a plan that indicated extensive mitigation efforts internally, and I believe Pennsylvania Department of Education was the recipient of those plans and the review of those plans, and then school boards get to make the final decision on what that all looks like. And I'm sorry that I don't have real specific details. It's just because once it's in the Pennsylvania Department of Education, I'm no longer able to help with that decision making. But I do recall there was a mechanism for them to go back in person with some plans and some significant review put forward. I hope that helps. Thank you.
So the focus is basically on the local control and local decision making, right? With the guidance of DOE, DOH, and the CDC on the upper level, right?
That is how I understand it. And also, I think it's important to know locally our relationships with the school districts. They all have pandemic coordinators. Those pandemic coordinators have been phenomenal resources throughout the entire pandemic. They're very well educated and trained, and they work closely with our disease investigation staff, contact tracing staff, as well as our environmental staff, and then our school liaison. So in reality, we have really great working relationships and points of contact and communication. So for that, I'm very thankful, and I think decisions are being made to the best of their ability, and then they have all the support we possibly can lend them to help them navigate anything that they may come across. Thank you.
Thank you.
Okay, and we'll go back for a final quick question from Erie News Now.
One final one for both of you, actually. Data from the state shows that white Pennsylvanians are being vaccinated at rates more than 3 times faster than black Pennsylvanians. Just your reactions to that disparity and whether or not you think it's happening in Erie County and what can be done to correct that.
Well, obviously, it's something that we are working hard here in Erie County to make sure does not occur, and if it is occurring, that gets remedied quickly. So we're working with our partners that we have been working on in terms of the health inequities. The neighborhood centers are one example, the partnership helping to let them sort of drive this in terms of getting the right people to vaccination opportunities, and our health partners are also working on that, our larger health partners, AHN, UPMC. So there's work being done in Erie County, and Director Lyon may have something more specific that she'd like to say to that.
Yeah, thanks for the question. I think, from a public health perspective and understanding social determinants of health, high risk and vulnerable populations, we know that communities of color or minority groups tend to have a multitude of issues or it's a complex, multi-layered decision making as well that lends itself to this. So I'm going to go through a few of those. This is not a comprehensive list, but it's truly what we're focusing on. And I tell you, we talk about this every day, and we're making plans to deal with this routinely. So one is a trust factor. Those populations typically don't trust governmental entities, and they don't trust health systems. They've been taken advantage of historically, and so to ask them to step up and be the first to be vaccinated, that lends itself to additional mistrust and or concerns around why are you choosing me first. I've heard locally that that's not the case here in Erie County, but I know that that is clearly the case across the country, and I suspect it is impacting the Commonwealth. Two, they have barriers to getting access, whether that's transportation barriers. The time that the vaccine is offered can tend to be through working hours. They may not have sick time to get away. They may be homeschooling, so on and so forth, so unable to get away during those hours. So they have significant barriers there. Data collection as well has been lacking, and that was one of the reasons why the governor's order came out last Friday about data collection having to be accurate and timely. There has been significant demographic data missing from the information submitted into the vaccination portal or the state immunization system. We are prioritizing those populations with the vaccine that's being secured through the Erie County Department of Health and working in collaboration with our LECOM partners and talking with our healthcare providers. I know that they are doing the same. They're trying to really intentionally reach populations that are difficult to reach, and they're using community leaders to help start those conversations and navigate that process. So from a public health perspective, we did not fix our disparities overnight throughout this pandemic, or throughout, I shouldn't say overnight, over the last 12 months in this pandemic, but we surely have brought them forward in our decision making and our lens, and ideally that's very important for moving forward, to have a country that prioritizes health equity for all. And this is we should learn from this and not let this happen again and continue to make improvements. So I look forward to reporting how we do as I know that moving forward through the pandemic. Thanks for the question.
Thanks.
Thanks, Ethan. Star, do you have a last question from Jet TV?
Yes, I would like to touch on our state representatives here in Erie County reaching out to Governor Tom Wolf about the vaccine allocation across the state and how it's been unfair here in Erie County. Wanted to get your insight as the county executive on this and any conversation with our governor or state officials down in Harrisburg about what we can do to make sure that there's more vaccine rollout here.
So we've had some conversations a couple weeks ago. I think I mentioned that we did not get an allocation through the health department, and neither did our partner, LECOM. And so conversations were had after that, and I think that situation has been remedied. But as was brought forward by the State Department of Health today, and as Director Lyon has been talking about, there's just not enough vaccine. Period. And so we are not going to see adequate vaccine coming here, not so much that it's inequitable across the state, but just simply because there just is not enough for all the Commonwealth. So I think that the state is working to do a better job of making it equitable across each county and through each region. But with that being said, again, the supply and demand just doesn't match.
Thank you.
Sure. Erie Times News, David, do you have a final question?
Yes, I do. First, I just want to quickly verify with Melissa, going back to the second doses. Melissa, so the county health department has not heard from any of the Moderna vaccine providers in the county that they're going to have to delay second doses. You haven't heard it from LECOM or anyone that's giving the Moderna vaccine, correct?
Yeah, since the announcement really just happened this afternoon, I have not had any conversation with the healthcare leadership in Erie County to know if this puts them in any particular difficult spot. So I'm not able to comment if it is or isn't going to impact them.
Okay. And then on a different tack, my last question is just, with numbers being fairly stagnant over the last 10 days or so, new case numbers, has there been any talk, and again, I know it's a statewide decision, but I'm sure you're getting pressure, Kathy, about businesses being able to open up further. Any new developments in that regard?
I'm assuming this is for me, David. No, there has been no new developments.
Yes, it is.
Thank you. No new developments that I have heard about. And it's important to remember that even though our numbers are much better than they were, today 62, yesterday 54, those are numbers from mid-November, fairly equal to that, but they are not the kind of numbers we saw back in August and September when we actually were much more open. So we still have a fair amount of virus in our community, and I want to take this moment from this question to push testing and ask people to please, if you have any kind of symptom at all, you may think you have a cold, you may think you have sinus, go and get tested, be sure, because what we want to do is make sure that we are stopping the spread in any way that we can. And you can find testing sites on eriecountypa.gov. And maybe to that point, I don't know if Melissa wants to talk a little bit further about testing, but we were talking a lot about that today and how important it is. So I'm going to see if Melissa wants to add anything to that.
Sure. Thank you, County Executive. Testing is still such an important part of this pandemic for us to understand where we are for virus circulating in the community, what the real positivity rate is, what our incident rates are. I know that that might not be what everyone else wants to focus on right now because vaccine is really the shiny new object to fight the pandemic. But in order for us to have a really good handle and understand how vaccine is or is not circulating in our community, we need to be testing. And my concern is that the overall testing is declining. Now, I know that we really didn't do surveillance testing, which surveillance testing would be testing anyone regardless of their symptomology or exposure. And for many, many months, I had always wished that we had a national strategy that had done that. But I do know that we need to continue to have testing. The other piece of this is if the variants are circulating in our community, the only way to identify them is to get tested and have those tests then sent for sequencing. So if we lower our testing rates, then we're likely to miss variants in our community, and that could be a game changer for how COVID-19 impacts us here in Erie County. So it's highly important, and I have been saying it's sort of a three-legged stool approach. There's vaccine as a therapeutic, there's disease investigating, which requires testing, and that leads to isolation and quarantine. And then third is just our regular good practice of mask wearing, social distancing, and hygiene. And if we do all three of those things very well, we're in a good position to get through this pandemic. If we ignore any one of those three things, it can clearly, it put us in an imbalance where the virus can still get ahead of where we need to be. So I just think it's very, very important, as well as if individuals are fully vaccinated, we need to know if that vaccinations is really giving the long-term immunity that we're expecting. And if we don't test, then we're not going to have that information either. So science is driven by data, and we need to collect data. So I encourage you to get tested when you're not feeling well. If you have an opportunity to get tested, please do that. It's very important to our response. Thank you.
Thank you very much. And that takes us to finally to Joel at Talk Erie for a final question.
Absolutely. Thank you. A question for both you and Director Lyon. You know, when folks go to the website, they fill out the survey to find out if they're eligible for the vaccine. They find out they're eligible for the vaccine, and then they're pointed to a map with multiple blue dots in Erie County. And then the requirement is to basically try at each blue dot to apply for a vaccine, and it's really kind of difficult, we're hearing, of people just being able to apply for a vaccine. Generally, you get it's sold out, or there's no appointments available, and so on. It's a blank slate. Are you finding out? Is there any talk about a universal scheduling process for the vaccine that would encompass either the Commonwealth or the county? Again, in this day and age of being able to order anything on your phone, people would think that this would be something that would be available.
So there is talk about this, and actually our local representative, Ryan Bizzaro, has a bill that he's trying to push to actually legislate that the state create something like this. And I am very much in favor of having some kind of a statewide system where people could just register, and then it would be picked up by the vaccinators who have openings. The only caveat to that is that if it takes months to do this, to get that system up and going, I'm not sure it's going to be even utilized in a way that would warrant the cost of that. So if we can take another system and quickly move it into Pennsylvania and do that so we don't have to recreate the wheel, I often think we don't have to do that. We need to just look to good examples out there. To me, that would be the best way to do it, so you could be implemented fairly quickly and be effective now while the need is so high. Melissa, do you want to add to that at all?
I don't have anything additional to add to a statewide system. I think you've covered what we discussed already. But please do know that with the governor's orders, they require that every vaccine provider by end of week this week have a website scheduler, so something on their website that you can schedule, which I know does not help those that are either without internet or not having computer access. However, they are also required to have a phone number, and that phone number must be answered by a live person, and that live person must be able to help them schedule an appointment. So they're technically have made some improvements to that. What I see happening, Joel, is each of the providers are limiting how many appointments they're making because they're not confident the vaccine's going to be available. So if we schedule people out for 1,000 appointments, because that's 1,000 doses, and we only get 500 doses, now we have to reschedule 500 people for a time that maybe vaccine becomes available. It becomes a really cumbersome management issue as far as scheduling. So I understand why it's happening. I'm not saying that it's appropriate that it's happening, but that is what I believe is leading to getting on, trying to get a schedule, try to get to an appointment, there's nothing available because we're not putting out enough appointments because we don't know when vaccine is available to us. We put in orders, and sometimes they're filled and sometimes they're not. We put in orders and sometimes they're partially filled. So it's really difficult right now, and we just ask everyone to be as patient as possible. We're getting there. We're working as hard as we can. Believe it or not, you've never seen people work as hard as that are working in this department and working in other health departments and working at the state level. It may not translate that way when you're trying to schedule your appointment, but I assure you we are working as hard as we've ever worked to get this thing done because we want out of this pandemic as fast as everyone else. So thank you.
Thank you.
Thank you. And I will say anecdotally, some friends of mine told me they just got a call out of the blue from their healthcare provider. They are in the 1A, and they have been trying to get appointments, and they got called, and they were being scheduled within like that week. So the only unfortunate thing is those people who are not covered by health insurance or don't have a personal care physician may not have that advantage of someone actually eventually calling them. But do continue to try, reach out to your PCP, get yourself on that list so that you are one of those people that they will reach out to. So thank you to Director Lyon. Thank you to everyone for the really great questions. I think this was a great discussion today. I want to always recognize at least one of our star businesses. Today it's Blaze Pizza on the Peach Street Marketplace. They're doing a great job. They have their maximum capacity posted, clearly self-certified, their floor markers to space people out while they're waiting in line, plexiglass between the booths to create a barrier between the people sitting in the booths and eating and the people waiting in line, and lots of signs posted including denoting a no standing zone so that people don't congregate while they're waiting for their food. So as always, thank you to our businesses for helping to mitigate the spread of this virus here in our community. Thank you to all of you who are doing your part to wear your mask, keep your social distance, wash your hands frequently, stay out of crowds, and stay home when you're sick. In the meantime, till next week, please stay safe during this pandemic, and please stay safe. Thank you.